Remedy, brought to you by Coos Health and Wellness. My name is Eric Gleason, and this program is designed to keep you informed about health and wellness topics that affect Coos County. Today, I am joined by Amber Madigan.
Hi. She
is the Accreditation and Breastfeeding Promotion AmeriCorps Vista from Coos Health and Wellness. Thanks for coming, Amber.
Thank you.
And today we're going to talk about breastfeeding. So what is it about breastfeeding that we should know? What's the most important thing?
Well, breastfeeding really benefits everyone. There's health benefits for the baby, including lower rates of diarrhea, ear infection, lower respiratory infections, asthma, and emphysema. And they also have lower risk of sudden infant death syndrome, developing obesity, allergies, and type 2 diabetes. And then when it comes to the mom, she has lower risk of breast cancer, ovarian cancer, osteoporosis, heart disease, and developing postpartum depression. And then the employees who really support breastfeeding in the workplace, they can see higher rates of employee productivity and company loyalty, and they'll see lower absentees due to a sick child. And then when it comes to the whole county and community as a whole, we see less packaging in our landfills and oceans. And then we'll have reduced carbon footprint, and we can also reduce various illnesses and health conditions because we have healthier babies.
So breastfeeding in general improves health outcomes for the county as a whole?
Yes, it does.
So outside of the fiscal benefits to employers,
yes,
what does breastfeeding in the workplace do for the mother and her child?
The amount of breast milk a woman produces on an ongoing basis is determined by how often her baby's breastfeeding. And a mom and baby normally breastfeed every 2 to 3 hours.
Okay.
And so when a baby breastfeeds, she takes out that milk from her mom, and then it replenishes in between. And so when a mom goes back to work, she really needs to keep expressing breast milk at that same rate so that the supply and demand is still there. And then the breast milk can be bottled and given to the infant when it's away from its mom.
Okay. So you want to be able to keep that cycle going, and if you stop that cycle, then it can
yes,
shortchange the baby.
It can, and this can lead to mom really having to stop breastfeeding earlier than she wants to because her supply and demand is just not there.
Right, which can become frustrating for the mom.
Yes.
As well as the baby. What kind of laws are there to protect breastfeeding moms in the workplace? Yeah,
so the Patient Protection and Affordable Care Act and the Oregon Rest Breaks for Breast Milk Expression Law requires employees to provide reasonable break times and a private space that's not a bathroom to express breast milk.
Wow. Well, that's... Wait, they were having to go to the bathrooms?
Yeah, some moms would go to the bathroom just for the privacy. That was the only space they could really find.
That's unfortunate. I'm glad that this is happening to make some things
yes,
a little bit more sanitary for the mom and the baby. That's
yeah.
So you guys have been working on a toolkit at Coos Health and Wellness.
We have. So we have the Coos County Breastfeeding Friendly Workplace Toolkit. And this toolkit really educates employers about the benefits of breastfeeding and what some of the issues are when women return to work. And it also provides tools on how to have conversations with moms when they go back to work, how to have support policies, and it has assessment so the employers can see how they're doing and what they should be doing to really become breastfeeding friendly.
Wow, that's great. How does one go about getting one of these toolkits?
So they can stop by Coos Health and Wellness and pick up a hard copy, or they can find it online on the Coos County website, and you can just search breastfeeding and it will pop right up.
That's great. Well, thank you so much.
Yes, thank you.
Thank you for coming, and thank you for joining us for this segment of The Remedy. For Coos Health and Wellness, I'm Eric Gleason, and remember, together we can inspire healthier communities.